Welcome everyone to the Places to Grow collective learning event. I don't even know, is it the 9th or the 10th, something like this. So Places to Grow is a catalyst for early childhood development in Czech Republic, Slovakia, and Hungary. And we are working with wonderful partners in these three countries. And we also organizing these collective learning events where we are sharing our insights, our experience, and our learnings. Today we have some projects that Places to Grow supported. They are part of the Joint Action Fund grant scheme. We created the Joint Action Fund grant scheme to support innovative and collaborative projects. Well, what does it mean, these kind of buzzwords? So we supported projects that wanted to try something new and who were eager to work together with others to achieve their goals and to achieve the ultimate goal to create better circumstances for all children to grow up and become a valuable part of our societies. So without further ado, I would like to just let you know what are you going to hear about today. So as I said, we will have 4 Joint Action Fund projects that has been granted a small amount of money to do their experimental projects. And you will hear today from Aleš Jirešek from Amalthea. You will hear from Melinda Vartik from the Hungarian Foundation of Lamenda. You will hear from Zuzana Kucherova from the Czech ECD Platform, and you will hear from Miroslav Klempar about their project. So you will hear 4 short presentations or introductions of these projects, and after that we will have a Q&A where you can ask any questions you would like to ask these projects. So I think I'm handing over the stage to Aleš Jirešek. Aleš, please tell us about your project. Thank you. Yeah, you are still muted. Your presentation is coming up. Yes. Yes. Half success. 50% of success so far. I think you need to click on od začátku on the left.
Yeah. Okay, and now I will share my screen od začátku. Okay. Now, is it working? Can you see my presentation?
Yes, perfect. 100% success.
Oof. Okay, thank you. My name is Aleš Jirešek, and I will introduce you our project, which is called Support for Establishing an Early Intervention Care System at the regional level, which means the area where we are implementing our project is Pardubice region, specifically Chrudim city and Pardubice city. First, let me start with short introducing of our organization. Amalthea is non-profit organization with more than 20 years experience in supporting at-risk families and children. Our goal is strengthen families and children can grow up in safe and health environment. In recent years, we focus on early childhood care, and we are trying to to cooperate with other institutions and with other stakeholders in this area, like to support the system and cooperate. We run preschool club for vulnerable children, and we have long-standing cooperation with kindergartens and primary schools in Chrudim and surroundings. And for many years, we coordinating local early childhood intervention platform, where we can meet with important stakeholders and institutions and talk about the topics connected to at-risk children. Our project aims to improve cooperation between all sectors, I mean education, social service, and healthcare. And the aim is identifying at-risk children and support them and their families. And why? Our experience in the field shows that at-risk children are identified too late, and the problems are very complex to solve. And these kids are the amount of these kids is growing last few years, and professionals like psychologists and other professionals, they are often overwhelmed and they have no time, and the problems are growing up. And there is no cooperation between sectors, and especially we see limited participation of healthcare professionals. That's why we decided for this project. And the reason is that for us, healthcare professionals are like first persons which can meet at-risk families and somehow start the support. And when we talk with them, they are mostly motivated, but they have no tools for they don't have enough tools to identify at-risk children, and they have no awareness of support system for these families. And then the intervention is delayed, and as I already said, the problem is getting more complex and the solution is hard to find. That's why we want to build some bridges between sectors and provide healthcare professionals some tools for responding these problems effectively. We have three main aims. First is promote understanding of early intervention care and its benefits. Then connect with healthcare professionals and provide them some tools. And the third aim is involving educators in early intervention care. Now I will explain you each of these three aims. We want public and professionals understand of early intervention and benefits of early intervention. That's why we now developing advocacy strategy. We already designed some one-pager we can show to stakeholders, and we are working on local version of Kit Card, which made SOFA organization, which is a great tool for pediatrician and other healthcare professionals to use for identifying at-risk children. The other aim is connecting with healthcare professionals. That's why now we are analyzing existing practice, especially in maternity hospitals and pediatric practices. Then we participate in local meetings of pediatricians and introduce them social service and supporting services for at-risk families. And yeah, as I said, we try to implement some practical tools for detecting these children. The third aim is collaboration with educational institutions. We started to collaborate with University of Pardubice, then some secondary medical school in Chrudim and College of Social Work in Pardubice. We organize some seminars and workshops for students and talking about importance of early intervention. We provide some internships for these students in our early intervention center, and in cooperation with university, we already started with two students. They are working on their bachelor thesis, which topics are working with at-risk mothers in maternity hospitals, and the other topics is using identification tools in maternity hospitals. What are the challenges for us for rest of the year? We want to connect with active pediatricians and talk about their needs. We want to select and improve some effective tools for early identification, and then find some tools for pediatricians how to connect families with support services. And of course, we want to, and that's the most difficult point, is to involve of local municipalities and other stakeholders to the process of creating this system. Yeah, that was short introduction of our project, and thank you for attention.
Thank you very much, Aleš. That's a great project, I think, and I especially like your focus on the health sector. I think that's one of the low-hanging fruits that, with some work we can all benefit from to be involved into early childhood development. So thanks again for doing this. I wonder whether anyone has a immediate, instant question or comment to Aleš until the presentation is fresh. Yes, Stano?
Hi, Aleš. Thanks. I would like to ask, how to put it, like, where are we in the sense of, um, yeah, do the pediatricians already know they need something but don't know what, or do you also have to work on their motivation, or they already know what they want and they come to you with exactly the task of like what learning they need, or where are we in this? This is what I like don't know at all.
Yeah, thank you for this question. Where we are now, when we talk with them, they have motivation. They know that they need some support, because yeah, they told us that they can see at-risk children, but they have no idea about support services. Yeah, and the other problem is that they have no time for finding that, and yeah, so that's why we need to find some practical tool for them, how to orientate in support services, and how to talk with the families and with parents to send them to social services. But the motivation is already there, and that's good start point.
Thank you. If there is anyone else who has a question or comment. Christine, I'm not sure whether you are trying to ask something or your mic is on. Okay, seems like there are no additional questions. Thanks again, Aleš, and good luck with your project. So next we will have Melinda Vartik from the Lamenda Foundation, which is based in Hungary, Balassagyarmat. Melinda, the floor is yours.
Thank you, Maxim. Welcome, everybody. I try to share my presentation. Hopefully it doesn't work properly, but
So I'll go with you to tie up and get the car, lah.
Okay, that sounds good.
Hey, do you bring my toilet paper?
do you see in a full screen?
Not the full
Not yet.
Maybe it's gone now. Sharing again. Yes.
Now, is it okay? Okay, finally. Finally. So my name is Melinda Vartik from Lamenda Foundation from Hungary, from Balassagyarmat. Balassagyarmat is in the Nógrád County on the east part of Hungary, around 60 kilometers away from the capital, Budapest. Our project is based in Balassagyarmat. We want to establish a child welfare roundtable here, and no. Okay. I'm saying some words about our foundation. It was founded in 2016. At the beginning, there was only one goal for us to provide daycare for children under the age of 3 here in Balassagyarmat. But then, if we saw the requests and needs from the local people, we also established more goals for our foundation. But the main is provide the daycare. In this goal, we run 4 family childcares in Balassagyarmat with 28 children at the age of under 3. Also, we organize summer camps, children programs during the year. So many, not only children, but family programs for everybody. The other goal is to emphasize the role of the family in the society. We saw and we still see that the people are working on being in balance at the family and at the workplaces. So we would like to help the families in this issue. Also with some problems, we are at the beginning to support these goals, but in the future we want to focus on these goals also. And the third goal is activate and motivate some local communities, especially for young children with diabetes, and also with children at the school. And also we started to initiate civic roundtable in Balassagyarmat. So these 3 goals are on which we are working. I put some photos from our life of the foundation. The main thing is to have very good colleagues, volunteers, children, and also family, my family, who works to achieve our goals. And I also put the local major in the middle to speak that I can say that we have a really good relationship with the local government, and I always say that it's important to have a good relationship with the government, and especially in this project, we really want to cooperate with them, collaborate with them. And also there is an expert here, which we usually work with them. So, and now it comes the video. If you can
Yes.
put it. Yeah, it's only around 1 minute, so not too long, just to see one of our program.
So, Melinda, if you can stop sharing, I can share.
Okay.
Mm-hmm.
A bit of our life.
It
I don't
still
know if there
doesn't
is a
have
sound.
sound. Yeah, maybe
No?
No, doesn't work now. We tried before, it works. So
Work.
let's see why is this happening.
Mm-hmm. Mm.
This program was last year when we celebrated the 10th birthday.
Just a second. I think we might be able to.
Technology always working when you're testing, never working.
Thank you.
Now it works. Yeah.
Take me away. I need to get out of here. My life is a mess, I can't take it no more. Let me escape from my distorted mind. Don't hold me back and unchain me right now. Please don't let me go to waste. I need my memories erased, 'cause I'm running out of space and the mirror shows no face. I reach for a sky. Oh, why won't you take me outside where I'll be
Opa.
That was it. Okay. Back to my presentation. Can you see? Okay, so we saw the problem that here in Balassagyarmat, and I think in the whole country there are lots of really good experts, professionalists, and so on. But we saw that there is no connection no collaboration between them, not even with the parents, not even between the experts. So in our project, we would like to have cooperation to help to have a cooperation with the experts, parents, also include the children, the whole family in the decision, into the help, and we would like to see a really good dialogue and communication between these sectors. And also, I didn't put in the round the blue things, but we need them. The local NGOs, local government, and so on, and also to support from the business sector and other sector. So as you see, the main goal is to have this statement and being in a real life. With this, we would like to prepare a local childcare strategy and also prepare a sustainability strategy to support our project in the future. And so that's the main vision of the project. And also have a kind of family-centered approach to early development, to focus on the child and the whole family and its immediate environment. As we see, the parents are the most important people for the children. They know lots of things, but not everything. So we would like to help the parents and the families with professional meetings, presentations, good practices, consultations, and also some professional information materials, and help them to, if they need something, to go somewhere to try the best way to solve their problems and needs. This establishing the this goal is the goal is to establish the foundation of effective collaboration. It should be cost effective and also professional effective. So these are the main things. And also, as I said, that the children and then the family will be at the center, and we would like to build not a house, but around the child and the families to save them and solve their needs and problems. I put this sentence, which is from the United Nations goals. Then I think it's not just our goal, it's the goal of United Nations, and also it should be a goal for everybody, for all countries, and also for everybody. These are again some photos of our life. You can see that in our programs, the center is usually the families and the children. Every year we organize summer camps for children, family and half days for children and families. Also, we attended in Eger at the Early Childhood conference, which was really inspiring, and we got so many ideas there. So we can include also for our project, and also some pictures from the Civic Expo, which we organized in 23. I think, and this is the end of my presentation. Thank you.
Thank you very much, Melinda. Thank you for sharing your project. I think fostering collaboration and working on collaboration is something that Places to Grow values a lot. This is one of our main missions. So thanks for doing this project. I'm wondering if anyone has a question to Melinda after her presentation, or we can take questions later. Zuzá?
Yes, thank you, Melinda, for your presentation. I very appreciate it because I'm keen on local level and that's really a very interesting and complex topic for me. And you have mentioned the family approach, and maybe I would like to ask which parental needs does the project address? What are the important needs you are reacting to?
Yeah, especially during the last 10 years when we ran the family day cares, we faced so many small and bigger problems. For example, they really don't know where to go if there is a problem. I mean, problem, for example, in eating, not being being prepared, for example, for the kindergarten. As Ales said, that there is a lack of time of the expert, and they don't really get the help from the expert because of the time. So we would like to have more connection with the other experts and invite them to our family daycares to find them a time to discuss with the parents. And also they really don't know, they don't really dare to ask the expert, for example, the doctors, neurologists, dentists, and nurses, just, to go there, to phone them, and then ask and tell us about the problems. So they are more open to discuss these things with us, not with the experts. So, and then we would like to educate, kind of, to give them a kind of education to discuss these things with the experts. And also there are some good practices which we can share with them and show them. And we also, see the problems, and they told us about the digital life, what to do, how to do it, how to solve it, not to give them the phone and so like that, how they can read them the poems, how they can teach them to a song and so like this. So most of the parents are still children. So I think it is also the problem that most of the parents are still children, not real adults, and they have to educate them and we try to solve this somehow. And also we see the big problem in the eating and feeding the children in a good way, in a healthy way, so which causes more problems if they don't get a health food and have a good habit in eating.
Yeah.
Thank you.
I'm afraid we need to move on because of the time limitations we have today. So next we will hear about a quite bold idea from the Czech ECD platform. Zuzana, the floor is yours.
So, hello, I hope you can see the presentation. If you can just, yeah, perfect, great. My name is Zuzana and I work for ECD Platform in the Czech Republic, which is an umbrella organization. We have more than 60 members, and thanks to the Joint Action Fund, we can focus on communication, because communication is the key to the system change, we believe. Yes. Why this project? When we talk about early childhood development, we are talking about the foundation of healthier and more resilient society. But here's the challenge. Many decision makers don't see that way. And it's often invisible in political discussions. And that's why there is like no action. Last year, through the Primokis program, we spoke with many local governments, and this is what we learned. It's not from the research, it's really from our own experience, from real conversations with municipalities. The information isn't just enough. People move when they feel personally connected to the issue, and that's where our communication must begin. So we know that good intentions are not enough, and we need to be understood. And there is no better opportunity than the elections. But I will start from the beginning. Last year, we created a short video which introduces ECD to the broader audience. And in the beginning of this year, this video aired on national televisions, in cinemas, in social networks, and it reached more than 2 million viewers. And the topic is slowly entering public awareness, and now it's the time to turn that momentum in concrete political commitments. In this year in autumn, there will be parliamentary elections, and we see it as an opportunity for us. With election approaching, politicians are more open to the new ideas, and they are listening, and that's the crucial moment for us. And our goal is to put ECD topic to the election programs and then to the government programs. So that's our goal. And these are the activities that we are going to do. We will have a 2-day communication workshop for the core team of ECD Platform. And also we will have a workshop for convincing argumentation training. For our members, every year we organize summer school, and this year we will focus on communication skills and presentation skills. So it is really important for us to educate also the platform members, because they can apply these skills in strategies locally. And at the end of this project, we would like to test our new strategy. We will have focus groups where we will test that this new strategy works. We would like to really bring people that have never heard about ECD before, and to be sure that we are understandable. So these are the activities. And these are our strategies, because at this moment, ECD is quite niche issue, and we would like to change it. And we would like to change it because from our own experience, I would like to say it. For example, in Plzeň, when we communicate that the support is only for disadvantaged families in town of Plzeň, which is like a region, like town in the Czech Republic, it didn't work at all. The municipalities were not open to it. When we frame it, it's only for disadvantaged families. But when we frame it differently by saying, do you think it's okay that parents in Plzeň face worse conditions than anywhere else in the Czech Republic? Or do you think it's okay that all parents pay more money for social services in Plzeň than anywhere else in the Czech Republic? Suddenly it worked. So we understood we have to change the communication, and we would like to focus on messages that speak to emotion and reason. Then we will not focus on mass campaigns because instead of it we are focusing on targeted influence. That means direct meetings with politicians from all major parties such as ANO, ODS, and so on. And we would like to bring a concrete real-life examples like Primokis in Ostrava Poruba to show that change is not just needed, but feasible. And to do this, we need to build our own capacity, which means that we have to work with PR experts and really implement it in our own communications. These are the experts that we are going to work with. I will start with Martin Kafka. He is a journalist, copywriter, and he helps us he helps us with written text because he's really good in text that is understandable and clear and effective. So this is someone that we are going to work for the written text. There is Petra Boušková. She's an expert in presentation and communication skills, and she will help us to speak, communicate, and convince more effective way. And there is Štěpán Drahokoupil. He's an advocacy expert. We've been working with him from the very beginning, and he will try, or together we will try to turn this communication in actions. So these are the experts because we know that we don't need to speak louder. We just need to speak more clearly. That's our message, because real change doesn't come from noise. It comes from clarity. So that's our goal. Thank you.
Great. Thank you very much for presenting this bold initiative. We really like it at Places to Grow, and fingers crossed that everything goes your way. I don't know whether anyone has questions to Zuzana at this point. Can take questions also later. Maybe I have a question then. What brought you to the conclusion of not making a mass communication campaign, but identifying some specific targets, target audience, and develop a communication strategy towards them?
Yeah, because well, like I said, at the beginning of the year, we had this video in the Czech TV and in cinemas and so on. But right now, we believe it's more convincing and more effective if we have these meetings with politicians, because we already have some and it works. And we have to find someone who are really listening and who feels that ECD is something that he or she wants to stand for. So we think it's more effective, and that's what we are just focusing right now. And also like by help with Petra Boušková. She's an expert, and we believe she will help us how to communicate like in elevator pitch to be like really convincing, you know, but because sometimes you have just few minutes or some moments that you have. So we think this can work.
Okay, so we will expect you to approach politicians as they want to enter the parliament, and you will persuade them in those couple of steps from their car to the parliament. All right, thank you very much again.
Thank you.
Good luck. And now we will hear from Miroslav Klempar about their project at Awen Amenca.
Yeah, I'm sorry I didn't, I was not prepared to present, so I tried to make some presentation, so it's simple, but I think it will be okay. We will, is it document? No, screen number 2. Okay, do you see the presentation?
Not yet, but it's coming up. I think we just need to, yes, now we can see it.
Okay.
Slideshow.
Yeah.
Yes, now we can see it full screen.
Okay. Our project is called actually Bridging the Gap, Building Trust Between the Roma Families and Preschool Institutions. We actually approach this early childhood from another end, but the outcome is actually similar as the Czech, what's the name? Platform for early childhood. So we are, now we are in momentum in Czech Republic where you know the segregation and education of Roma children is discussed actually in the big scale on the all levels, from the municipality level, school levels, you know, up to the government, up to the ministries. And we have to use actually this momentum and not just wait what will happen, what actually those on the top will decide. So we need some pressure from the bottom. Sometime in the discussions, we hear that we are trying actually to desegregate, but the question is if the Roma wants actually this, you know, if the parents want this, you know, and all this. So we want to show actually that here is actually the you know, here is the demand actually for good quality education from the parents. So this was actually our approach. When we wrote the first draft of the project, we wanted actually to have some base of evidence, you know. So we planned some research, you know, some questionnaires, you know, and then show this actually to the representative. But we know actually that this was taken also. So we are working now with the existing data which we already have. We, as Awen Amenca, we are working with the education of Roma from 2013, and we are actually supporting the access of Roma children to education. The early childhood actually is the new for us, you know, it's like a new approach, but not just now, but you know, a few years ago, actually we decided to go this. We are members of the early childhood platform, and our main focus is actually the community empowerment, advocacy, and legal support, but we also come actually in working with the children. We hear that you know the things that some officials are interpreting that Roma doesn't appreciate the education is actually misinterpretation of this problem. Is not actually the mistrust, or is not is actually not the lack of appreciation, but is actually the mistrust of the system. So instead of working with that, some institutions are actually happy just to say that they don't care, that they don't actually appreciate the education, and that's it. We can't do nothing. But that's not true. We have to actually gain the trust of the Roma families to education, especially in that sensitive age of the child, when the child is small, and you have to hand it actually to some officials, which is, and you suppose actually this official, this person is hostile, doesn't like Roma, so it's hard actually, so the trust is actually very important in this process, When the children is older, when the school years are mandatory, then actually, yes, okay, that's okay. But, when you don't need actually, it's not mandatory, and you don't trust the system, so you don't actually cooperate, or you don't use the system. So we want actually, the project is built actually on the trust and the consultation, and we want to show that Roma actually appreciate the education. They want actually better life, better education. We can't say that they don't want live better, to be educated and have good jobs. Our parents are actually the Ostrava University. We will use some data from PAQ research, and we will closely cooperate with the ECD platform, Czech ECD Platform. We are lucky that we have some kindergarten teachers in the platform. We have some municipality representative in the platform, so it will be actually a good place for testing some things before we will go actually public. The first phase is not the research, but it's the research review. Actually, is the research of the existing data, planning of the outreach, testing. Just yesterday, we published actually one article in Romea, and it has actually great amount of comments and good reach. So that's good, and we can actually we set the base for this debate, because it's a lot of questions in that. So, and it was the question actually that is necessary actually to invest in this early age to have some outcomes later, and the premise was actually that the first 5 years is actually the most important time in the child's life and his future and his actually. So that's and we have a lot of comments, a lot of questions, which we can further discuss in next. So it was really successful. Then we will do some cultural sensitivity workshops and campaigns. So we will carry on now. Actually, the target group are the parents and the Roma parents, and later on it will be the officials, teachers, and the ministry and so on. And then we will do some advocacy policy briefs, and we will try actually to suggest some systemic changes in the for policymakers. And now actually we have the elections. We will have the elections in a couple of months, so we will use actually this, and we will also speak to potential politics about this theme. And I think now is really the momentum when the Czech society realize actually that we can withstand actually this segregated approach. So we have to do something because we are losing actually the potential of this Roma population, and also we have to change actually we have to change the view of that, to not looking on this as the problem, but as the opportunity for some change. Expected outcomes actually increased the Roma preschool enrollment of Roma children in early age, not just mandatory in 5 years, but also the children 3 and 4 years. Improve the educators' sensitivity about cultural things, and the practice to inform them actually that Roma there are some cultural differences and how we can actually work with them, and some formal policy recommendations. We are now actually as Awen Amenca are actually working on the new anti-discrimination law. So we will use all these things we will learn, we will use in our policy recommendations on the ministry and other institutions. So key stakeholders, I said already, Roma parents, preschool education institution, not just in Ostrava, but also we will reach the other cities, Ostrava University, PAQ research and ECD platforms will replace for the dissemination and policy making. Impact actually will be on the model of inclusive early education, engaging Roma parents as the equal partners for the schools, influence local and national educational policy, and scalable framework for marginalized communities, which can be used actually for in other places. Always the Ostrava was actually some with the DH case, and other cases all happen actually in Ostrava. So we want actually the Ostrava to be first, or somehow pioneering, this idea of using the potential instead of talking about the problems. Yeah, that's all our team, and risk and mitigation, we know about that, so we will work actually to lower or to not have this risk, and that's it. Yes.
Thank you very much, Miroslav. Just on time. Unfortunately, this time we don't have more time for questions. But thank you very much again for delivering this presentation and introducing the project. I think it's important to take a closer look to those cultural differences and figuring out that despite the differences, how things could still work. So I think that's what your project is doing, and I think it's very, very important. Thank you for everyone to join us today for the Places to Grow collective learning event. I think we will have one more this year. It's on 17th of June, before we kind of go to our summer hibernation mode. So feel free to join the last one. It will be something different, something informal, but we would like to have you there. Have a great rest of the day and rest of the week, and we hope to see you soon. Bye-bye.
Bye-bye.
Thank you. Bye.
Bye-bye.
Bye-bye.
Bye.